And how about your husband? What's he say?
Well, I don't know. He doesn't believe Grady was going to be shut down, the dialysis clinic, but it does happen. So right now, it's like he doesn't even know what is going to happen. He's really scared. He's really, really scared now because he is also on dialysis and he knows how important it is if you don't get a treatment. And he's really scared for me.
And he's able to get the treatment because he's a citizen of the
Yes,
United States.
he
He was
has no
born here.
problem. He was born here and he has no problem with getting dialysis. I'm the only one that has the problem, and even though he has insurance, he can't put me on his insurance. That's the way it is because it's not a private insurance. So I'm on my own right now.
But he's very
He's
afraid.
very very afraid, but he's very very supportive. Even though a lot of times he doesn't show it, but I know he's really scared, of losing me if I don't get my treatment.
Now, you take care of a lot of people yourself as a nurse. Like,
Yes.
what type of conditions do you help people with?
Well, I do a lot of home care. I've worked in so many hospitals, but because of my kidney failure and because of dialysis, because I have to go to the clinic 3 times a week, I have to go to the doctor's appointment, so I have to do something that is flexible so I will have time to take care of my health needs. So I'm into home health care and I take care of babies, sick babies. I take care of elderly. I take care of people that have maybe they have a wound and they need their wound to be changed at the home. So I go to their homes, change their dressing. I do a lot of infusion in the homes. They said experience is the best teacher. I'm a sick person and I know what it is when you are sick and when you need care and you have to get it at the right time, with empathy and I mean it's just what I like doing. And I don't see myself I don't feel fulfilled if I don't work. And that's the reason why I need to have my dialysis treatment so I can go out and do what I love doing more.
Yeah, I mean, if there was a committee of people, like some nephrologists, kidney experts, some patients, such as yourself, who are very knowledgeable on this, to sit down together and try to work through all these issues, that to me seems like it would make a lot more sense
That's right.
than for people to be frightened and potentially to make decisions that might not be in their best interest.
I think when Grady made that option to close down the clinic, I don't think they really consulted with the nephrologists, with the people out there because they knew the importance of dialysis. And even if they were aware they were going to shut down the clinic, they never believed they were going to do it because they've been talking about shutting down the dialysis clinic for years and they never put it into plan. Because I believe if they talk to all the doctors that are working at the dialysis clinic, the nephrologists, the dialysis nurses, maybe Grady Clinic will still be open by now because they will really let them know what is really going on, the inside of what dialysis is and the importance of dialysis.
Yeah,
But I think the board of directors, they just made their own decision. They're going to close the clinic down and they just went ahead and did it anyway.
yeah, I had spoken to some nephrologists myself. I had training in nephrology, but some who are doing this all the time, and they said that they were not, they did not think an option was to tell people to go to emergency rooms for care because we know that these people, many of them, will die because of the problems of going 3 times a week and then waiting and then not being able to get treatment because you're not sick enough and not knowing when you're going to be sick enough, and that the potassium can go up and
Exactly.
your heart goes into a rhythm problem and you can die. Uh, So they did not feel that was an option. But you received a letter, didn't you, at one time saying that one of your options is to go to emergency rooms?
Yeah, those are the first letter. That was the first letter they sent out, that if you don't want to go to another state or go back to your home country, then you can come to the emergency room. Even then, it's good. That would be very, very expensive than doing the 3 times a week dialysis treatment. To go to the emergency room will cost them more than the scheduled, ongoing 3 times a week dialysis. It's not an option. The only option.
But none of the kidney doctors were in agreement with that.
No,
So
none of
it
them
was
did
people
agree.
who were not kidney doctors who said that this is
They
the
were not. I
policy?
don't. If the board of the Grady board of directors. I don't think the CEO is a doctor. I don't think so, because if he was, I mean, even if he's not in nephrology, he will know what dialysis is. A lot of people don't really know what dialysis is all about. They don't know, and that's another thing that we need to let them know, that this is a life and death situation. It's not like you had to go for surgery and for them to remove whatever is bad in the body. This is something that has to be ongoing. You got to keep doing it, and a lot of people don't really know what it is. I believe that somebody is going to come up to our aid and help us in this difficult situation. I believe so much in that, and that's just my hope. And you don't want us to die. You want us to live, and there's joy in doing that, and blessings of God in helping people in need.